All this is Dr. Mobeen Sayed from DrBeen.com. Welcome to one more show. Long, long time no chat. So let's start our chats on a weekly basis on these Fridays. I want to start today. Of course, I would not let you go without something to know, and I believe many of you would already know this. Fried chips and fried foods are really bad for health. So if you have any inflammatory state, stop eating fried foods. So I can explain those mechanisms later on, but that is my message right up front. Okay, so welcome everyone. How is everything? Welcome, Alexander. I want to quickly now show you, before we talk about more things, let me show you some of the paintings I did in the last few weeks. So this is one. And I did another painting in the same style, but a little larger. And that is this one. And and this was a tiny painting which so there is a painter who painted this type of a style, and I was trying to see, can I reproduce that or can I change color schemes and see. So it is, you can call this a study. So I have been painting and learning to paint. All right. So welcome everyone. How about we start with the fried foods? Would you like to discuss fried foods and why these are harmful? I also saw there is another question in the beginning. That question was from Faguda Cat. I would love to ask about the GIT issues post-COVID and vaccine. So I can very quickly start our question answers from there, and then we can continue to talk. And before I go there, do you think that I should give you an email address where if you have a question that should be addressed here in the Friday chit chat, you could send it to me? My only fear is there'll be so many rhetorical questions. There'll be so many questions that I couldn't answer them all, and then people would become upset. Plus, I then receive a lot of hate mail as well. So if you like, I can do that. And so I'll let you guys think for some time. And if you think it is a good idea, then I'll give you my email address only for the questions, and you can send the questions there. Okay, so the first question, the GIT issues. So the ACE2 receptor are present abundantly in kidneys, GIT, blood vessels, heart, brain, of course, lungs. Actually, GIT has more ACE2 receptors compared to lungs. I think it is the second most dense receptor containing area. So of course, if there is spike protein, if there is a virus, for example, it is going to bind to those ACE2 receptors, and it is going to cause inflammation of the GIT tissue. Now, the problem to solve is the GIT issues in long COVID. And so there is no mechanism that has been shown. However, this is observed that about 37% of the long COVID patients have GIT issues as well, or GIT inflammation. The theories that have been circulating have been, number one, repeated infections by the virus, which we then think that these are chronic long COVID, but it is actually repeated infection, one. Second, this one I do not believe. I have not ever seen a study with that, but a low-grade persistence of the virus in the GIT tissue where it just keeps replicating and keeps causing inflammation. The third one is that as we take medicines for long COVID, some of the medicines themselves cause damage to the GIT. And then the psychological or psychosomatic outcome, where as we develop long COVID and our anxiety and our stress then causes our immune system to become more active as well and dysregulated as well, and that causes it. So all of these are postulations. None of these are proven, but there are various studies that show that GIT is involved. So I hope that answers that question. I believe I am big on mechanisms. So from a mechanistic point of view, probably not to a satisfaction, but from a observation point of view, that does this happen? The answer is yes. So Alexander says, when my food intolerance were at their worst, basic old school French fry was one of the few items I could eat without making inflammation. That is excellent and very interesting, because the French fries themselves are really damaging. But here you are with French fries actually being the only food you could handle. So I guess we all have a different setup. So Dennis says, Dr. Bean, you're a truth sayer in the medical field. Love your advice. Thank you very much. I don't give medical advice because I just should not, being an internet doctor. But uh, information, education, that is something that we should all have. And nowadays, it is even more important that we should know this. And talking about that, I also wanted to show you something. I have been I created two courses that are on DrBeen.com. One is on pain and pain management. In the context of drug enforcement agencies, narcotics and controlled substance, and the pain management with or without opioids. So that it has CMEs as well, and that is on DrBeen.com. Plus, very recently, I am finishing, actually this Tuesday, we did the 7th lecture, inflammatory pathways. So think about it for a second. We all talk about inflammation. Even now, the very first question's answer was in the context of inflammation. And then we know very little about inflammation. And we know very little about how to manage inflammation. And we know very little about the lifestyle choices and the food choices that we can, and the habits that we can develop that can help against inflammation. And as we are aging, and I believe after COVID, it is actually a problem with the whole generation now, the whole world now, we develop inflammation, which is subclinical first. Subclinical means there are no symptoms yet, but the inflammation is sitting inside and it is chipping away at the tissues. And finally, the tissue damage becomes sufficient enough that symptoms of various diseases start appearing. For example, diabetes occur, for example, cardiac issues occur, strokes occur, renal failure, GIT issues, and lung issues, and so on. That we say is the clinical horizon. And the inflammation now become chronic, unnecessary inflammation. There can be necessary inflammation as well. So we should know what that is. What are the important pathways that are working underneath? It is so interesting for me that medical community, medical education systems, the big pharmas, the researchers, they do not bring this message to us to say, here is how to handle your inflammation. At the end of the day, for example, if we talk about ibuprofens or aspirins or naproxens or celecoxibs, what are these? They control inflammation. They control arachidonic acid pathway. We should all know the important pathways and how to modulate them. I did a few videos as well before. So I have done about 7 videos so far. There is one more video to go on DrBeen.com, and that whole set is present there as well. So let me just quickly show you this. If you go to courses on Dr. Bean, so if you go to Dr. Bean, click on the courses, then if you go near the bottom, it says inflammation here. It's in the alphabetical order. So in the inflammation, you would see the omega-3, omega-6 key inflammatory pathways, 1, 2, 3, 4, 5, 6. And now I recorded the number 7 on this Tuesday, and then next Tuesday I'll do the number 8. I think next Tuesday or the Tuesday after. And this, I think, is the key for health and healthy lifespan. Everyone should know these pathways. And the way I have discussed these pathways is, here is the mechanism, and here are the lifestyle, and here are the supplements, and here are the allopathic medicines that would help modulate them. And for example, I talk about curcumin and EGCG and boswellia and NSE and glutathione and so many other omega-3s, etc. So my request to you is, please make sure that you are up with these pathways so you can have healthy life. And that is really, really important nowadays. Healthy uh, life with less inflammation. Do you know that diabetes, COPD, renal failures, cardiac issues, strokes, cardiovascular health problems, underlying everything is inflammation, chronic inflammation. So if you start attacking that area, then the secondary diseases will become tamed, and it is very important. So sorry, but I am so passionate about it. Monica says, would you do a video on peptides? Yes. So I actually have collected a number of study papers, and I'm just reviewing them before I open my mouth. So, okay, so now let's see. When you have a question, please put QQQ with the question. Also, rhetorical questions are not useful. So let's have good questions that we all enjoy discussing them together. Quinn says, what are your thoughts on RFK being in Trump cabinet and going after corrupt big pharma? Politics, let's leave it out. I am not super fan of politicians. So thank you very much for asking this. Because I don't have very good political inclinations, I don't care for. Um, very good. Yi Ota says, may your P53s make all the right decisions. Absolutely. For everyone. Barbara says, the situation with regard to COVID induced inflammation is dire and no one else is really talking about it. I know it all too well. And you are correct. And what I'm seeing is, okay, so let me tell you something that is really interesting for me to observe. I'm going to give you in the context of Barbara's question or comment, I'm going to expand on something, and that is our medical community, our medical system is geared, is very much tuned to, for example, help us for diabetes, help us with COPD, help us with the cardiac diseases. There are tons of medicines. There is tons of research. There is millions of dollars of grants going in all of these directions. And it makes me amazed that if your doctors tell you, let's say you have diabetes, which is diabetes is defined as chronic progressive disease, meaning it would stay with us and it would keep progressing. And we have seen clearly from many doctor studies, Dr. Jason Fung, one of them, who have given patients intermittent fasting and cut carbs therapy. And a person 27 years on insulin dropped insulin within 3 weeks. This amazes me that inflammatory state management is not a technique that is given at the baseline for everyone. And we keep munching away and keep trying to manage the secondary aspect of the chronic inflammatory diseases outcomes. Diabetes, type 2 diabetes, is actually a result of the chronic inflammatory state. Even type 1 diabetes is an autoimmune disease as well, but I do not think that there are genetic predispositions there. So I do not think we can just manage that with inflammation control. But it surprises me that every doctor does not start with us to say, what is your chronic inflammatory state? I want to understand what is your body's status before I start treating you. And if there is a problem with that status, I'm going to manage that first, the inflammation first, then we look at the diseases too. Anyways, that was a rant. You asked for chit chat and you got a rant. um, okay, so If there are not many medical mechanism questions, then I would start going over some of the the mechanisms about fried foods. So Trish says, thank you, Dr. Bean, for all the information you provide. I'll tell you, my most favorite video that you presented was the one talking about Oreo cookie lowering cholesterol. That was a fun talk. Yeah, that was. That was. Okay, so I don't see many cues here. So I'm going to go. Guy says almost missed the. So Roger has another interesting question, and again, another policy question. And so I can only give my comment. I cannot tell you what they were thinking at that time. I still feel bad that masks were mandated, and then they were not mandated, and then they were mandated, and then the similar thing with the vaccines as well. And so it surprises me that government thought that they had the power to mandate this way. Now, what were their reasoning for those policies? Maybe they were just like all of us, just not too aware of the situation, were not able to predict correctly. And so they just tried to do whatever. But I think there was a lot of hindsight 2020. I think there were lots of mistakes. For example, remember in the beginning, they said masks are not needed. And then they said masks are needed. And when they said masks are needed, then they said, we said masks were not needed because if we had said these were needed, then you would all go and buy them and there will be no masks for healthcare professionals. Now we have masks, so now we are saying it is mandated. That is not protecting your public. That was just stupid way of managing a condition. If you thought masks were necessary, then tell the people up front that they are necessary and then go manage them, instead of saying, well, we didn't tell you that because we wanted to protect the healthcare. I mean, this is just mandates is a policy problem. I do not, in the hindsight, I do not agree with the way these were enforced, especially because of the mandates when they fired healthcare workers. So these were the people who were putting their lives on the line to help those who were sick before vaccines. And the healthcare system, our administrations were okay with these people putting themselves on the line. Then came the vaccines, and then came the mandates. And then all of a sudden, the same people who had been putting their lives on the line were now the ones who were the bad people and needed to be fired and their livelihood taken away. That just, it doesn't make sense to me. But again, I'm not um, I was not in that position to make those policies, so I do not know what their own drivers and factors were. So Jean says, what tests would you run to fully assess inflammatory state? So consider that inflammatory state can occur because of a vast number of etiologies meaning causative factors. Then these in turn activate a vast number of inflammatory pathways. Because of that, if you wanted to have a true fingerprint, then you could keep piling on more and more and more tests. However, I would start from the more traditional easy tests to understand, and then from there one can grow further. So the high sensitivity CRP and interleukin 6. These are two standard tests to understand a person's inflammatory state. And I feel that we should all get these two tests now and then every quarter till we understand what is our body's behavior and what is our state, and then maybe 6 monthly or yearly. And if we do have a trend of inflammation going up or going down, based on that, we need to start actively managing our own inflammation. I am not sure in all in most cases, doctors are inclined to do that. So at least these two tests to start with. So I'm going to write it here, HSCRP, that is high sensitivity C-reactive protein, and interleukin 6. There are then other tests, for example, interleukin 1, tumor necrosis factor, VEGF, um, GM-CSF, interleukin 12, interleukin 18. So these would come later on. First, these. And these would provide an indication that there is inflammation or not. Then once we know there is inflammation, and please also remember, these tests once in time may not be sufficient, because maybe today I ate something that caused inflammation. And if I get my test today or tomorrow, I may have inflammatory markers that are increased. However, maybe that inflammation will subside in 3 or 4 days. That offending agent or something that I ate is gone. On the other hand, what we are looking for, we all together, what we are looking for is chronic inflammation, a state of inflammation that is not going away, that is continuously chipping away at our tissues. So for that, we'll have to create a trend. We do these tests now, then we do them again 3 months later or 6 months and a year, and then we figure out what is our trend. And if the trend went up and went down, then we are okay. If the trend is up and stays up or continues to increase, then we should be concerned and start managing it. So, John, I had done mine about a few months ago. So I would like to actually get them again, because that was just one in time. John says, I give up. I keep hitting enter on accident. I'm sorry, John. No worries. I can piece together your messages. Alexander, I hope you're doing well. Let's all quit this video now to get inflammation level test. Yes. And let's all quit this video now to get our ankle brachial test. Get your blood pressure from all of your limbs, upper limb both and lower limb both. Same electronic BP apparatus can give us a good enough blood pressure reading from the arms and from the ankles. Use that. I have done another video to say an easy way, an easy at home test for plaque. So if your blood pressure in the legs is way more than the blood pressure in the arms, that means the blood vessels that are taking blood to the legs, these have become narrowed or stiff, and that is why the blood pressure is actually increased. Similarly, if they're stiff, the blood pressure is increased. If they become narrowed, then the blood flow is reduced. And so in both cases, you have to understand how much increased or reduced, and that would tell you if there is a problem with the peripheral artery disease. If there is a problem with the peripheral artery disease, then it is possibly a problem with the coronary artery disease as well. And so it is a very important test to do, and I have done a video about it, and please do that. I believe that nowadays we have to manage our health by ourselves. And these are just simple things to do that. Old school says, I see a bunch of cues. Okay, let's see. Ari says that ankle brachial index was a great discussion. Thank you very much, Ari. I think it is very important for us. I was surprised actually that there were some folks who even under that video commented, it's not necessary, doctors don't have time. Well, we have time. It is our health. We probably give more attention to our car than our health. We go for oil change, and we go for service, and we go for air pressures and cleaning, and we just give that much attention to your own self. So very important. Alexander says, do DIY medicine. And Alexander, you have helped yourself by watching Raylan's channel and by helping yourself as well. We have to help ourselves. So Fern says, does one need to stand, sit in a chair, or lie down? Lie down. The only thing is, I said that in that video as well, that we will be all nervous that something is going to show up. I'll have peripheral artery disease. That means I'll have coronary artery disease. And so the blood pressure is going to fluctuate. So just keep repeating or keep doing it over time, many days, so that you become more comfortable and familiar with it, and then take your readings. Somebody even commented, you are worrying people. No, this is important for us to do. Why do we take blood pressure? Should we say don't take blood pressure because you're going to be worried? Yeah, I would rather be worried to understand what my blood pressure is and go manage it instead of never knowing. Quinn, Quinn, thank you for your comment. Doctors do good things as well. I'm a doctor. Okay, so what are other cues? This is a very interesting. So Kurt Seki says, any studies on individuals with sensitivities to lisinopril may also have sensitivity to the first vaccine. I have not seen this. There may be studies, I have not seen them. Margaret says, an autoimmune issue be highly localized in the body in a small area of the vasculature or a small area of the nervous system. Mostly autoimmune issues are generalized. However, they can have localized effect. The reason for that is autoimmunity includes a huge number, a vast number of diseases where maybe the macrophages are not working correctly, or the mast cells are not working correctly, or B cells are making antibodies that are attacking the thyroid tissue or the heart tissue or the vessel tissue. So it is possible that autoimmunity could be generalized or it could be localized against some one tissue. So it could have local effects. Denise says, if my father's cardiothoracic surgeon can take his BP in all limbs as busy as he is, any practitioner can. Yes, and we should. And think about it, we can do it. We should do our ankle brachial test every month and keep an eye on it. And we should stay within the normal range. The sensitivity of that test is low. So if you are normal, it doesn't mean that you do not have the disease. But if the specificity is high, so if you have the disease, then you have the disease, a greater chance, only 8% false. So it's really an important test, just like we do BP or glucometer. Just like I believe that we should all have continuous glucose monitors to understand what spikes are glucose. And that is very important for us to know. Similarly, ankle brachial test as well. So Run Death is Near says, do you scroll? I sometimes do scroll. Sometimes it's just there are so many comments passing by that I can't scroll, um, long enough. Okay, so let me show you some studies. So Shroom says, where can we find a list of doctors who will provide these inflammation tests and give complete diagnosis and treatment? So I may have to create a company where I enroll doctors to work on the chronic inflammatory state. Nothing else. No rheumatology, no immunology, nothing else. Just chronic inflammation and how to manage that. So let me show you once again, um, at least watch these lectures. And I have done them in a way that is easy for all of us. So look at these lectures that would educate us to understand what is the chronic inflammatory mechanisms and how do we get ahead of them. With every lecture, I've talked about the clinical topics and how various supplements, lifestyle can help. So make sure that you see them. And talking about that, I was going to start discussing some studies. Talking about that, I wanted to. So, this book, Dr. Joel Furman, Eat for Life, he will be our guest on this Monday. And full disclaimer, I am not a plant based person. And he, of course, is. And that is why he's written his book as well. And he has a lot of anecdotes and helpful hints. So I wanted to hear that from myself as well. And I thought it would be great to hear for you to hear as well. Again, what food style choice you make, that is your choice. But I thought that is a great message to have. Jackie says, will the ankle test work right with a plate and screws from breaking my ankle on the outside and pin and a wire on the inside? So, as long as there is a palpable pulse, just like we can see our pulse here, you can actually find your pulse on your ankle as well. As long as there is a pulse that is palpable, then the cuff can do the work with that. Absolutely. Long haul healing says cutting out sugar and grains. Yeah, sugar first. That would help a lot. Cutting out carbohydrates would help a lot. I believe this strongly. If we, and I eat carbohydrates too, so meaning I'm not advising it to you, this is just a common message. I believe that if we cut carbs for 2 or 3 weeks, 2 or 3 months, if we are diabetic, we'll actually go back to normal state. And if we have fatty liver, for example, if we cut fructose and sucrose as well, our fatty liver, non-alcoholic fatty liver, if it has not caused enough cirrhosis and damage, it is the beginning of the fatty liver, that would get reversed. So I do not understand why we do not put an effort. And why does a doctor not put an effort? I can say to everyone over here, don't eat carbs. Many of you are in an age and in a state of body that if you ate carbs, they don't do much harm. But many of us need to. And it is a doctor's job to indicate to us the importance of it. I remember for diabetes, they say, well, here is your plate and it should be this way and it should be that way. And I get surprised. Do you know that when we become diabetic, our hemoglobin A1 score, the targets are recommended to be between 7 and 8. And when we are healthy, we are said to be up to 5.6. So what happens when we are diabetic? We should not be healthy anymore. So higher A1C means higher glucose levels, and that's okay. I know that they do that because they don't want to have you so aggressively control glucose that you become hypoglycemic. But that is patient education. Even a diabetic patient should have healthy A1C targets. If you give them a target of 7 or 8, that means you're asking them to keep their sugar levels high enough that would chip away at their kidneys and blood vessels and cause strokes and heart attacks and renal failures. You've just delayed it, but it is inevitable. That's wrong. And the answer is very simple. Instead of giving insulin, and here is the pill number 1 and the pill number 2, and metformin is there, and SGLT2 is there, and DPP4 there, and ask the patient to cut carbs. Ask the patient to walk after every food. Ask the patient to take some lemon juice, for example, maybe 2 or 3 drops before starting the food. And that would kill the amylases on the tongue and reduce the absorption of the carbohydrates. Ask the patient to take foods with low glycemic index. Eat fruits with low glycemic index. Eat fruits or sweet things if you're going to after the food. Have less processed food. These are simple things to adhere to if somebody wants to manage their body. Anyways, um, um, so H, this is a difficult thing for me to give a personal advice, and so actually should not do that. So because of that, I can't talk about a case, but I understand what you're saying. Female, high ACTH, normal cortisol, high ACTH, normal cortisol, high male hormones. So get your suprarenals checked. High ACTH, so adrenocorticotropic hormone, so pituitary. Did they do your pituitary workup? And did they do your hormonal workups? It should be easy to figure out. Yeah, so hormonal workup, starting from the hypothalamus and hypophyseal pathways, and that is pituitary and pituitary glands and their work, that is where you'll start from. And then because the ACT, adrenocorticotropic hormone, is high, that means the the way your suprarenals are working are kind of not very well understood by the pituitary. So pituitary is continuing to ask them to work harder. So you just need to do the workup of the pituitary and then the workup of the suprarenal glands. Everything else would come later. Okay. Cynthia says, Dr. Bean, Crypt Rick is asking about ankylosing spondylitis and supplementations, adjuvants. So the discussion that I did about the inflammatory pathways. Ankylosing spondylitis is also one of the uh, a disease that is aggravated and based on chronic inflammation as well. So control your chronic inflammation, the best process to control, considering you do not have any autoimmune genetic predisposition, or you do not already have some memory B cells sitting somewhere in the bone marrow making inflammatory substances or T cells. Cut your carbs and reduce your fried foods and eat foods with the low glycemic index, and have, for example, have guava and blackberries and blueberries and raspberries. Have those fruits with the least number of carbs, more fiber, and less glycemic index, and see how does that do. You might actually just be able to change your lifestyle towards from chronic inflammation towards more normal, and you might see a lot of benefit from that. And then, of course, talk with your doctor. Barbara says that was an excellent lecture on inflammatory pathways. So, eighth will be next. I have done 8. And here is a good news. I'm writing a book about it. I strongly believe if we can control our inflammation, we can be healthy. Jamie, your condition, you should talk with the doctor. You should go to emergency. Yeah, chest pain should never be taken lightly. Denise says, inflammatory pathway is my love language, Dr. Bean. You're very welcome. I really think, Crip says, thank you very much, Massimo. You're very welcome. Jamie, please, it's not about NHS and trust. When you have chest pain, this could be heart involved. Please go to the doctor and emergency. Okay. I want to share some studies. So Vicky says, hi, I wonder if Dr. Bean can answer you because he can't give. Yeah, so I can't and I shouldn't give medical advice. And I don't practice in the US. But that doesn't mean that if I was practicing in the US, I could give medical advice over the internet. That's just not right. Leah says, not many doctors watch conscientious videos like this. Doctors are busy people, but I think their busyness, and if they don't find time for these things, the patients patients get hurt, and they are responsible for patients. That's their job. Okay, so Hank says, so that is good. Hi, Dr. Bean. I read somewhere that in the old Chinese tradition, when you could when you called for a doctor, he would get paid only if the patient was cured. I kind of like that idea. Yeah, some patients cannot get cured that fast. So I don't want you to go without looking at some studies with me. Or do you just prefer this chit chat? I'm trying to add value to this chit chat. So do you think looking at some studies would add further value, or this is value? Yeah, so this is a problem. Red Pool says my doctor is always busy on vacations. This is a problem. Change your doctor, and your doctor should be doctors. Their job, they took this job in theory to serve people. I know that many of the doctors become doctors because it gives good money, but service is the basic thing to do. And I think even if you look at the universe itself, we human beings, what is the most important thing we can do? I'm going to become a little spiritual for a second. Please forgive me. I know I'll get attacked for this, but praying to God, everyone can do it. Serving someone is also a prayer, and it is a more difficult one. And I think it has more rewards as well. Okay, so Medhead says, what do you think about flu shots? So flu shots have been out there for a long time. There are actually elderly who need to have flu shots to stay protected. Otherwise, they can end up on ventilators, have severe infections, and die. So there is a community, there is a group of people who need flu shot, and they should have flu shot. Thank you, Sigrid. Extreme fatigue. Yes. This extreme fatigue, these seem to be hormonal imbalances as well. Daniel says, do you think Mpox can be a global threat? I don't think so. And here is why. Look, COVID was a respiratory disease. So people could talk, laugh, sneeze, be around each other, and pass it on. Mpox needs a sexual contact or contact with the injury of a injured rash of a person, or with the fomite, that is the uh, I'm laughing for a somebody left a comment on my mpox video yesterday, and they corrected me and said, do you not understand, I'm paraphrasing them, do you not understand that viruses need a host? So you say that the fomites, that is, secretions or things present on the other objects, you are saying that the virus could be viable on these things. Do you not understand that there is no host there? So sometimes it becomes very difficult to have discussions. But fomites, so for example, all the bodily secretions of an infected person have the virus in them. And if that person, let's say they touch their mouth or nose, and then they touch a knob or a door or a table, and then before it all dries up and the virus disintegrates, if you touch it, you can get it. So still, the transmission needs a lot more interaction with the patient or the virus, um, unhygienic places, before one becomes sick. Secondly, the sickness causes the person to become, rashes and all that. And so they become a little conserved about their moving about. So this is a sexual interaction is needed, but not always. Just touching can do this as well, or touching the fomites. So it is more difficult to spread compared to respiratory viruses. So can it enter a larger number of countries? Yes. Would this mean that it would create, that would be declared as pandemic? Of course, if it crosses borders, it is a pandemic. But would this be like COVID? I do not think so. And this is also incorrect. Somebody was saying, well, this is only possible if this is gay sex. That is not true. A straight sex or even no sex can cause transmission of mpox, even from mother to child. So there were some strange comments. Somebody commented, why are children getting the mpox? What are they doing? And so weird comments, but mother to child within the pregnancy, to fetus or to newborn, can be given. And so, correct. Incubation period goes from 4 days to 21 days. Normally it's from 5 to 13, but even that is long. So yes. Okay. All right. So that is that question. Let's now look at some studies before other questions come in. So let's see. First of all, there is this one study. Um, this is the consumption of potatoes and incidence rate of coronary artery disease, the Million Veterans Program. So this study is about potatoes, not fried potatoes only, because I see this a lot, that whenever the food frying is a topic that comes up, majority of the uh, thinking and the literature mentions that when you fry a food, you dehydrate the food, you take the water out, and you add a lot of saturated fats and trans fats to it, and that is what causes the harm. That is not the entire story. That does cause the harm, but the modification of the food itself, the molecular changes that appear in the food, the oxygenation of the food molecules and hydrogenation of the food molecules, these end up causing the food to become inflammatory. So it's not just the fats, it's the food itself gets modified as well, and it becomes inflammatory. And so when the oxygenated molecules or hydrogenated molecules would enter our body, wherever they'll touch at GIT, they would cause inflammation. The food molecules have become modified. Wherever they would touch, they can cause inflammation. And now we have a problem. Okay, so uh, check this one out. This one is, potato consumption is highly prevalent around the world. Previous studies have reported a positive association of potato intake with hypertension and type 2 diabetes. However, data are scarce on potato consumption and risk of coronary artery disease. Now, I also want to give you this thought here, that it depends that when we have potato consumption, then how do we have it? What else are we consume as well? Is this excessive, or is this normal or lesser than normal? For example, Penn and Teller, the magicians, Penn, when he started losing his weight, he says that for first 2 or 3 weeks, he only ate potatoes and cut everything, and then he started dropping weight. So it also depends, what else are you eating? But here is a study. Objective. We hypothesized that potato consumption is positively associated with the incidence of coronary artery disease among US veterans. The design. We prospective mean they start from today and they keep watching people from now on. We prospectively studied 148,671 participants from Million Veterans Program. We used a semi-quantitative food frequency questionnaire, and questionnaires and surveys can make the studies a little weaker to assess consumption of baked, boiled, and mashed potatoes. No, they're not talking about fried potatoes here, baked, boiled, and mashed. The incidence of coronary artery disease was assessed through electronic health record. We used blah, blah, blah. So let's see. The average age of participants was 64 years at the time of potato assessment. A total of 6,309 new cases of coronary artery disease occurred during a mean follow-up of 2.7 plus minus 1.4 years. Median potato consumption was 1 cup per week. The crude incidence of coronary artery disease from lowest to highest category of potato consumption. That means people who are eating less, let's say 1 cup per week, to 2 cup per week or 3 cup per week, and so on. Here is the incidence, crude incidence, unadjusted incidence of coronary artery disease was 14.5, 15.0, 15.2, 16.8, 2.9 per 1,000 person years. So you can see that as the potatoes are eaten more, the number of incidences have increased. Hazard ratio of CAD was 1, that was reference. And then if you see here, 1.21 for 5 plus cups per week. So 21% increased hazard or incidence for someone who eats 1 cup of potatoes every day, almost 5 plus days. So that is a very important thing to understand, that eating, this is baked, boiled, mashed potatoes, not fried. 21% increase incidence. And it is not that lesser was not associated with the increase, but that increase was tiny. For example, I think it is 1.02 was 1 to 3 cups. Then 1.04 was 1 cup per week. Then actually 2 to 4 cups per week. And then I have to just line up those numbers correctly. 21% was 5 plus week. So this is an interesting one. Please reduce your potatoes if you have inflammatory states, and do talk with your doctor about it. Then here is fried food consumption. Fried food, they're not talking about potatoes now. Fried food consumption and risk of coronary artery disease. Same program, Million Veterans Program. And here what they say is, this was also a self-reported fried food consumption, so that can always create some weakness in the study. And they had asked for people eating fried food lesser than once a week, 1 to 3 times or 4 to 6 times. And here is what they found. Of 154,663 MVP enrollees, the study enrollees, with survey data, mean age was 64 years and 90% were men. So not extrapolatable to women. During a mean follow-up of approximately 3 years, there were 6,725 coronary artery disease events. There was a positive linear relationship between frequency of fried food and consumption of, and fried food consumption and risk of coronary artery disease. Linear dose dependent means there is a very strong association. And what was that association? If somebody was taking fried food 4 to 6 times a week, 14% increased risk of coronary artery disease. So fried food should just be out of our general eating habit. So frying is a common method of food preparation in the US, both at home and in restaurants and food establishments. In addition to altering the taste of foods, the frying process modifies them through polymerization. That means many molecules of the food, they get bound, welded together, they become polymers. Oxidation, the oxygen is added to them, and hydrogenation. So these become like nuclear bombs when they go into our body, and they would just start attacking the tissues. And then all hell break loose. Then changes in diet and lifestyle and long-term weight gain. This is an interesting study as well. I believe this is Dr. Muzaffarian's study. Yes, Dr. Muzaffarian's study. So in this study as well, they talk about potatoes, chips, and fried French fries to be more harmful than other forms of potatoes. So what happened was when this study came out in 2011, there were some objections to this study. And I want to kind of have us go through those. Where did that go? Okay, so I need that link. So give me 1 second. One second, I'll be with you shortly. Okay, so I missed the link, so my apologies. But there was a discussion between the authors and some commenters. The discussion was of this sort that some other doctors who were commenting, they said the idea that potatoes are the culprits here is not the correct one. It is probably the frying and addition of the fats and trans fats and the saturated fats, and these are the ones that are causing the problem. And the authors are just trying to pin the blame on the potatoes, and potatoes are important thing and they're used worldwide, etc. I liked the author's response. Author said that it is not just the frying, it is the baked and mashed and boiled potatoes that also increase the risk. One. And secondly, they said that fats or cheese or butter by itself had lower risk increase than increased by the potatoes, especially French fries and chips. So the point is, if you are here in the chit chat today, I hope you will reduce your French fries. And I have cut them out. Here is why. My son, sometimes when he orders food from outside, he knows I love French fries. So he always orders me French fries. That is gone. No more French fries or fried foods for me. So see, talk with your doctor, do your some of your research, and see if you can cut out fried foods. Faraz says that focus need tweaking. Is it autofocus? So the camera focuses on my face. So as long as it is able to look at my face, if I have, for example, let's say this is the book here, it will not focus on the book. It would just keep focusing on the face. Similarly, it would not focus on my hand, focus on my face. But if I hide my face, then it would focus somewhere else. So uh, it's a camera that recognizes face and then autofocuses on that. Okay, so we have been now talking for 1 hour. John says, how about sweet potatoes? So I'll do some research on sweet potatoes because that is another thing that I love. So I have to figure this out as well, John. Faraz says, sorry, Dr. B, was my browser. Yeah, so sweet potato, Faraz, this Wednesdays. So for the audience here, on Wednesdays, for the audience members who are part of Patreon paid members or Substack paid members or YouTube paid members, I think it is $3 to $5. Substack is $7 per month. If they are members, we do 2 Zoom sessions, one at 1 p.m. Pacific time and then 6 p.m. Pacific time, and we do these discussions. So Faraz is part of that. So Faraz, maybe this Wednesday, I'll pick up the sweet potato studies and discuss them. So for Gouda Cat says, COVID vax and reinfection absolutely annihilates my digestive system. Can I ask why? So as I answered that in detail before, the very first answer was for your question. And that was the same thing. We actually do not have studies that show the exact mechanism, but there are a number of possible mechanisms that I discussed earlier. Les says, thanks for the chit chat, fun and informative. You're very welcome. I enjoy it as well. It's just that because of the length of these videos, not many people watch it. So, for example, let's say we have 150 people at this time. They are the ones who are going to watch it. Nobody else is going to watch it. So I thought it was. Ari says it's adding potatoes that salt that makes potatoes dangerous. I think that is an additional factor. Daniel, I'm not going to answer your question. So Perry says, is fried meaning deep fried or pan fried? So two answers here. All cooking can modify the food molecules because cooking imparts heat. If you're cooking with heat, then that heat would modify the food molecules. Just like when you fry an egg, it gets fried, it becomes modified. The frying has an additional factor of adding oxygens and hydrogens as well. That could be the longer you fry, the more oxygenation and hydrogenation of the molecules. The lesser you fry, lesser. Now, the question of pan frying or deep frying depends. If the pan frying is not frying the tissue, the whatever you're frying, as much with as much intensity as deep, then yeah, pan frying may be less harmful. But whenever you fry, you end up adding oxygenations and doing oxygenations and hydrogenations and other modifications by, so you're adding reactive species to the product, and that would then attack you back. So Chelsea says, does this apply to using natural saturates, for example, the seed oils? So there are various oils which have various compositions, and if you heat them or if you put them, expose them to light, they change and then they become harmful. So as long as an oil is used correctly, meaning if it is not supposed to be heated, then don't heat it. If it is used correctly, it is fine. Otherwise, if you use it incorrectly, then it becomes dangerous. So you'll have to kind of learn for every kind of oil that what is the right treatment for this oil. John says, would be interesting to know if there are studies on the impact of microwaving. I'm sure there are going to be. Jean says, would you like to share how others, if they wish, can join the Tuesday and Wednesday paid groups? Yes. So thank you, Jean. One can go to Substack, and actually this video's description has the links as well. There is a Substack link in there. You can go and become a member. There is a Patreon link in there as well. You can go click that and become a member. For YouTube, I think there is a member button below the video where you can just become a member. So thank you, Jean. So, A. Perry, there are some things that we can do. I mean, doing it once in a while. For example, when I was looking at the study with the fried foods, once a week was not very harmful. I think it was 0.02 increase. So really small increase. It is really when it becomes 4 or 5 times per week. So one can keep it in control. Plus, I would suggest, without giving a medical advice, antioxidants. So if somebody is really, really craving for it, then we should just make sure that we have antioxidants with it. Just like with omega 3s, we have tocopherols, vitamin E's that act as an antioxidant to help protect that. Good night, Cynthia. So, so Steph says that, do you think it is possible to detox of COVID spike protein vax? My elderly aunt bought a 100K kit with ivermectin and hydroxy, $100. So this is a problem. The problem is the following. Not everyone has the spikes, even if they are vaccinated. This idea that everybody who's vaccinated is making spikes and is making them forever, and they need to have this protocol or that person's protocol, and every doctor is now out with a protocol to devax and spike them. That's just horrible. Those protocols themselves can become a problem. There are people who do become injured, and the question that, are they injured because they're producing spike protein more regularly, or because their immune system became dysregulated, need to be sorted out. If somebody is thinking that they have a spike protein issue, then I would suggest that it's an expensive test. But there is a German company, what was their name? Um, Cell Trends, I believe. There's a German company. I have no commercial interest with them, no strings attached at all. I once invited them to come join us, and they said yes, and then they never appeared. Um, there's a German company called Cell Trends. They have a anti-spike antibody test that can be done to see if there is an anti-idiopathic antibody or spike that is present. Only then one should do these kind of protocols. Even then, I doubt that many of these protocols work. So people wasting time and money on these things and following these folks, giving them money, is just, one, they're injured, and then they're giving money to such people. So Sigrid says dandelion for spike. So for spike removal, there was a study that I discussed as well. It was an in vitro study where they used dandelion, and the dandelion actually caused the spike to not be able to attach with the ACE2 receptors. So yes, a dandelion is one of them. John says vitamin C fries. Yes, but don't fry vitamin C itself, please. That would make that reactive as well. Okay, so Steph says thank you. You're very welcome. Um, Butter says thank you. You're very welcome. So how about this? Yeah, so Cell Trend, I think it is Cell Trend. John is saying, yeah, Cell Trend. It is a German company. They have a lots of tests that are for autoimmune diseases. In one of those panels, they have tests for anti-ACE2 antibodies. And anti-ACE2 antibody presence doesn't necessarily mean that there is spike, but it does mean that B cells are making antibodies that may be attacking ACE2s. And so that may be because there is spike, and then there is anti-idiotypical antibodies, or that may be just the B cell making anti-ACE2. So that can be done. Otherwise, this standard messaging and narrative that is percolating, that, well, everybody has now the spikes in their body and they need to despike themselves and they need to have a detox protocol, these folks are taking your money and also giving you things that may not be healthy in all cases. So I become upset with that. Just like I do not like that talking about vaccine injury is such a difficult thing because mainstream rejects it. Similarly, talking about such folks is also a problem because then there is another group that becomes all excited. So there is a question about inflammation and kidneys, and the most important thing is to understand what is the reason for the inflammation. If it is an autoimmune disease where there is body attacking the kidneys, then that is a different way to manage it. But generally, I would always say to start with the HSCRP, IL-6 to understand what is the level of inflammation generally. If the person has higher amount of inflammation anyways, then overall inflammation control is even more important while looking at that autoimmune issue. Cool. So uh, Paul says, thanks for the increase in likes. Now 128 over 44, 89%. Thank you very much. Absolutely. So anything else? Any other thing before we break? And of course, do you know that we go out for a morning walk on Saturday morning, 7 a.m. Pacific, and we do a Zoom call and we just talk, all of us, and we talk and we walk for half an hour. You're welcome to join there as well. The links are on Patreon, and I post the links on YouTube and Substack as well, but on the paid area. Marcy says, thank you for having the chit chat again. Dr. Bean, I always enjoy the informal sessions. Excellent and very informative talk. Very good. Thank you. So the question to you, all of you, should we do it every Friday? If so, should we have the questions curated first, or this casual discussion is fine? I know it is not watched much, which causes the YouTube algorithm to think that my channel is just useless, that people don't watch, and it tries to then reduce the channel's viewership. So totally up to you. I'm happy to have a hit on the channel if this is something that you like. I was also thinking there is another possibility of us, if we are a limited number of people, we can move to Cool Bean Cafe and have the longer chit chats over there and leave this channel for shorter videos. Either way is fine, but we just have to be wise about it. Guide Alpha says, yes, we'll set our internal clocks. Very good. Thank you. Friday is welcome. Very good. Love it. Steph says, this format is good. Okay. Fra says, what will this slot be doing next Friday? So I came in without any particular agenda, but I did want to talk about fried foods. And I'm sure that I'll come in with some sort of a topic in my mind next week as well. I just don't want to have you go without any valuable thing. And so if somebody has an idea, please send those to me and I can look at that. Otherwise, I would just pick up something and we'll discuss. Jackie says you can get questions first and then take more if you don't have enough. That is a good idea as well. I always get so many that I can't even go through them. Paul says Cool Bean Cafe works. So we'll do this next time. We'll start having Cool Bean Cafe and this together. And I will introduce you to the Cool Beans Cafe. Then we can start shifting there. That way we can leave this channel to continue with the nutrition, health, inflammation, and those topics in shorter videos. So with this, Thank you very much. Have a nice weekend. Some of you will have a morning walk tomorrow at 7 a.m. And then remember, on this Monday, we'll have Dr. Furman join us. He's a big advocate of plant based foods. And I'll ask my questions too. And you are welcome to ask your questions too, 6 p.m. Pacific on YouTube Monday. And I would see you again. Bye for now.